Facelifts are back in, but one thing we want to avoid is the windswept look. So in this video, we are going to talk all about facelifts. Welcome to the center. My name is Dr. Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. Hi, my name is Dr. Azizzadeh. I'm a facial plastic surgeon, the director of the Center for Advanced Facial Plastic Surgery in Beverly Hills. And in today's video, I am going to share all my thoughts about facelifts and how to avoid the windswept look. If you enjoyed videos like this, please comment and subscribe to our channel. But most importantly, let us know what topics you'd like for us to discuss. So what is a windswept facelift? If you've ever seen a face when there's a huge amount of wind blowing on it, we look super unnatural. The skin is kind of ridging away. The edges of the eyes are showing. That's a windswept look. And that's a facelift or a type of facelift that we want to avoid, because if results are authentic and natural, you should look like you've never had any procedures done. And that's a sign of a great surgery and a great outcome. So how do you avoid a windswept look? Your surgeon has to utilize a technique that avoids pulling the skin and rather utilizes the deeper tissue layers to reposition in the appropriate vector the facial aging process. And the majority of the aging process tends to be in the jowls and the neck area. So that's why I utilize the deep plane technique for facelift. The deep plane technique is phenomenal because it doesn't pull the skin. It repositions the deeper tissues, fat pockets, glands to a more natural and original position. It has two advantages. One, it avoids the windswept look, and two, it gives the most authentic outcome and most long-lasting outcome. Now, when we're doing any type of facelift, we have to do it in a balanced way. So if the face, neck, cheeks are all done, but the eyes look super aged, that tends to look like there's something off kilter. So we want a harmonious appearance between the eyebrows, upper eyelids, lower eyelids, the volume in our cheek, lower face, and neck area. And when you combine the deep plane facelift with very, very subtle eyelid procedures, fat grafting, sometimes even rhinoplasty, then you get the most natural and authentic outcome. This is a gentleman who's just, has never thought about doing anything, but just felt like for his professional, personal, just looked older. And look at the neck. The chin goes all the way down to here, hooding around the eyes, undefined jawline. And after the surgery, the eyes have opened up. Looks a lot more well rested. Look at the jawline and the neck. Just overall, doesn't look like he's had surgery. He looks authentic, he looks natural, and looks 10, 15 years younger. So this is a younger patient. Her main concern was, look at the neck redundancy. And like when she tilts her head down, we call this the tech neck. Look at the rippling effect in the neck. And once we've done a beautiful deep plane facelift, look at how nice the jawline is. This is even an early result. This should last her probably another 10 to 15 years in terms of looking youthful and natural and authentic. In this lovely patient, we did look at the lower face, neck, undefined jawline, little hooding of the upper eyelids, brow position that's a little bit not shaped correctly, and look at how nice the eyebrows and the upper eyelids look. Transition to the cheek is much better. Look at the beautiful jawline. Neck looks a lot cleaner, and she just looks more youthful and natural and authentic. Doesn't look like she's had any previous surgery. Okay, so this patient came in after having a previous facelift. Look at the neck, look at the rippling effect here, some acne scarring, the poor jawline definition. And so what we did was, this is actually a very complex revision, deep plane facelift, where we were able to get that rippling improved, nicer jawline, We did some laser resurfacing and the skin looks better and the lower face looks much more balanced. Now, a deep plane facelift also carries some additional expertise requirements. And that's why it needs to be done by a super expert, not just an expert, but by a super expert, because the deeper tissue layers are very close to all the nerves of our facial expression, the facial nerve, all the muscles. So as a result, someone who's performing a deep plane facelift really needs to understand the anatomy, understand what the longer term repercussions are. And as a result, you really need to make sure that you see a super expert, not just an expert, but a super expert in deep plane facelifts and facial nerve anatomy. So please comment and subscribe to this video if you enjoyed it. And in summary, deep plane facelift is a fabulous facelift technique for anyone who requires it. Of course, you have to be a candidate, but you need to make sure that it's done by a super expert and that you discuss what your goals are with your surgeon, and that's the critical aspect of any relationship between a physician and a patient who's seeking aesthetic improvements.